My name is Dr. Edward Sanossian, and I'm a member of the Seattle Study Club Journey for Excellence chapter in Millburn, New Jersey, and I've been a member since 2010. I have a small tip that I'd like to share with you today, and that is the tip of developing a relationship with your patients by sowing seeds and gaining trust of your patients. Each time I treat a patient and I do a multidisciplinary treatment plan, I like to engage the patient in knowing what their needs are presently and subconsciously creating opportunities for my patient and for myself for the future. So I sow seeds in my treatment plan throughout each visit, especially my hygiene visits, whereby I will tell a patient, this is what we'd like to do now, and there's some things that I'd like to hold off for the future. This does two things. One, it allows the patient to realize that I'm looking at the broader picture and caring for them, not just today, but for the future. Subconsciously, they are learning that I will be their dentist throughout their lives, not only for this course of this particular treatment, but that I will be carrying and caring for them for the years to come. So by sowing seeds, I will allow the patient to hear time and time again, in the future, we're planning on working in this area of the mouth, in a particular region. We may do it globally, we may do it in a quadrant, and we may be doing multidisciplinary care in a much more relaxed environment and allow the patient to co-partner with us. These seeds that we sow allow the patient to say when they're ready. Many times a patient comes in and doesn't know what their needs are, and you realize you've listed a course of treatment that is beyond the scope of their time, money, and availability, as well as their ability to sit and carry on that care. This allows my patients to engage in the process and partner with us and then say, I've heard you say we're going to do that in the future. How about we do that now? How about we do that over the course of the next 5 years? And that way, when the time comes for this care to be delivered, when I re-examine a patient and I mention to them that a course of treatment needs to be done, they're willing to accept it. They always say, oh, you don't have to discuss this. We've already talked about it. Let's get started. That gives them the universal idea that I've earned their trust and they've earned my trust. We're partnered together and we're doing this together. Another important tip that I'd like to share with you is the ability to provide hope and give hope. My patients say to me that I have an incredible ability to listen to their needs and then to offer hope at each visit. Many times patients are scared, they're afraid, they're not even aware of what their needs are and how they can get solutions to their problems, because many times they've been ingrained over the course of a lifetime and they haven't even been able to share their concerns with themselves, their spouses, and their colleagues. And so they come to us and present at a time when they're in pain and in discomfort. And we turn around and quickly analyze the problem, treatment plan, and give them the protocol that we feel will help them get out of their present situation. Unfortunately, they leave many times hopeless because they do not feel that someone has understood what their concerns are. It'll take 3 visits, it'll take 2 months, we've got to move some teeth, we're going to go to the oral surgeon, we'll treatment plan, we'll set up a program, and we'll get started as soon as we can. They leave knowing that a project can be completed, but there is a sense that hope is not given. It is very important to generate hope in our treatment plans and hope in words. I can't emphasize how many hugs and gifts I've received, not only by delivering excellent dental care, but by offering people hope and saying it's going to be okay. These two tips of allowing hope to be developed and allowing to sow seeds have enabled me to take the skills and the talents that I've learned throughout my lifetime as well as all the information I've gained through this wonderful network of Seattle Study Club, bring it to life and make it very fruitful and rewarding and exciting to go to work every day and share my talents with my staff and my patients. And the referrals that I've received from my restorative and surgical colleagues have been tremendous because of these two tips that I would like to share with you today. Thank you very much.